If you consent to join one of the studies within FOCUS4, it's important to understand that neither you nor your oncologist or nurse can choose which treatment you'll receive. The allocation of groups within each study is by a process called randomisation. At the study centre, a computer randomly allocates numbers to patients. These numbers are then used to divide patients into groups that have different treatment plans. Randomisation might sound an odd way to decide what your treatment should be, but it's actually a very safe and scientific way to test new drugs. It's done so that we can make fair comparisons between groups containing a similar mix of patients of different ages, sex and states of health. Then, at the end of the study, we can be sure that if any differences are found, they're due to the treatment plan that you had rather than anything else. Let's listen to the doctors explain a little more about randomisation and how safe it is to have a treatment break.
We're doing it because we feel it's safe to do it. Okay, I think it's very key, as you say, this is a voluntary study, no one should be coerced into this, but we wouldn't wish to even suggest such a study to an individual patient if we didn't feel it was a safe way forward. Unfortunately, when we're trying to identify new treatments, the best treatments to go forward in the future, the best, the most scientifically robust and effective way of doing that is to do a thing called randomisation. And within randomisation, often what we are doing is selecting, using a computer or a similar method, an individual to receive one or another treatment. Within FOCUS4, often we have a proportion of the patients will be receiving the new drug, but a proportion of patients will not be receiving the new drug. And that is critical for us to be able to understand whether that new drug is effective. And the important factor around that is that the way that the trial is set up is, although some patients will be receiving a placebo, a sugar-coated pill that looks identical to the treatment, and in other parts of the trial they'll be actually told you're not receiving any new specific treatment. These are groups of patients in whom we've already used standard chemotherapy to control their cancer, and it's in a position where the tumour is currently either stable or it's shrunk, that we have demonstrated through previous trials that it's very safe to give somebody time off treatment. So that those who are receiving either the placebo or what we call the active monitoring are actually being monitored in a safe fashion, which allows us to be sure that we can watch them, and as soon as the tumour starts to grow again, we can reinitiate treatment, often with the standard chemotherapy. And we know within this group of patients that are eligible for the trial that will have no impact in terms of their overall survival, so that they are likely to live as long by doing it with that method as if they continued on chemotherapy or other treatments permanently.
You may think it unfair that you could be randomised to receive a new drug, a dummy pill or active monitoring. But for the new treatments being tested, we really have very little research evidence so far showing us that giving the new drugs is more effective, which is why we need to do the trial. So, if you do wish to join step 2 of FOCUS4, then you must feel comfortable about the process of randomisation. Your chances of being randomised to active monitoring, usual treatment, a new drug, or the way of giving it differ, and your doctor will discuss this with you.
It'll vary a bit from trial to trial. So in some of the trials it will be 50-50. In others it'll be 2-to-1. So out of every 3 people, 2 will get the new drugs and 1 will get active monitoring or a placebo. There may be some trials as we're going along where actually we're trying to work out which of 2 ways of giving the novel treatments would be best. So in fact there are 2 novel treatment arms. So out of every 3 patients, 1 will get one of the novel treatment approaches, another one would get the other novel treatment approach, and the third would be the control group with active monitoring or placebo.
In the next sections, we'll give you more details about molecular trials in general and also further information about FOCUS4N.